Hello students, in the last class we had discussed about few muscles of the back region. So here's a quick recap. This large trapezoid shaped muscle known as the trapezius having origin from the external occipital protuberance, from the nuchal ligament, from the spines of the vertebrae C7 to T12 and inserting onto the inner aspect of the spine of scapula, the acromion process and the inner border of the lateral aspect of the clavicle. This trapezius is innervated by the cranial nerve number 11 is the accessory nerve. So, the spinal part of this accessory nerve is going to give motor supply to the trapezius muscle. Now, students, coming to the next nerve, next muscle, that is the latissimus dorsi. This flat, wide muscle, as you had seen, it took origin from the T7 spine all the way till the L5, also from the sacral spines and also from the thoracolumbar fascia, and inserts onto the floor of the bicipital groove. Now, students, this muscle, it is supplied by the thoracodorsal nerve. The thoracodorsal nerve or the nerve to latissimus dorsi. So, students, we had seen these muscles in the dissection video in the last class. Here you can see in this image the entire origin of the deltoid muscle. On the spine of scapula, you can see this projection present, which gives rise to the posterior fibers of the deltoid muscle. So, this is known as the deltoid tubercle. This deltoid tubercle on the spine of the scapula. So, here you can see the posterior fibers. From the acromion process, you have the middle fibers, and from the anterior border of the clavicle, we have the anterior fibers. Students, the deltoid muscle, it is performing many functions like the anterior fibers, they help in the flexion and medial rotation of the arm. Similarly, the middle fibers, they help in the abduction. And this abduction generally takes place from the 15 to 90 degrees. And finally, the posterior fibers. They help in the extension and lateral rotation. Now, students, this important muscle, it forms the contour of our shoulder joint. So, if the innervation to this muscle is destroyed, then the muscle regenerates and the contour of our shoulder joint is lost. This leads to a very prominent acromion process. So, students, this deltoid muscle, it is supplied by the axillary nerve. The axillary nerve, it is not only giving the motor supply to the deltoid, it is also giving the sensory supply to the skin overlying it. So, injury to the axillary nerve, it will not only paralyze the muscle but also lead to the loss of sensation over a small patch of skin overlying the deltoid. So, this sign, it is known as the regiment badge sign. So, you must have seen the officers of regiment wearing badges on the region over their shoulder. So, since the loss of sensation is over that, it is known as the regiment badge sign. Alright. So, coming to the dorsal aspect of the scapula, we had seen over the spine of the scapula, we had the supraspinous fossa and the infraspinous fossa. Covering these are two muscles, the supraspinatus and the infraspinatus. Now, students, you can see a third muscle here. This is the teres minor muscle, and below that you have another muscle, that is the teres major muscle. All right. So, these muscles, as you can see, they are attached from the scapula to the humerus. Hence, they are also known as the scapulohumeral muscles. Similarly, on the ventral aspect of the scapula, we have another muscle that is known as the subscapularis. So this is the ventral aspect of the scapula, and this large muscle you can see, this is the subscapularis. Now students, why I want you all to know about these four muscles. Now, if you look at this image, as the muscles approach the humerus, they become membranous. Here you have the teres minor, here the infraspinatus, similarly the supraspinatus. And as they become membranous, they blend with the fibrous capsule of shoulder joint. So they blend with the fibrous capsule of the shoulder joint. Which muscles? The supraspinatus, the infraspinatus, the teres minor. So these three muscles from the dorsal aspect of scapula. And from the ventral aspect of scapula, we have the subscapularis. So this muscle comes from the ventral aspect. All these four muscles, as they approach the elbow joint, they become membranous and they fuse with the fibrous sheath of the elbow joint together. And this forms the rotator cuff. Students, kindly remember the rotator cuff, it is formed by the blending of the tendons of the four muscles, that is the supraspinatus, infraspinatus, teres minor and the subscapularis. In the subsequent dissection video, I'll show you the rotator cuff. Here it is a lateral view showing the rotator cuff. From above, you can see these are the fibers of the supraspinatus, and as they approach, they become membranous. Here you have the fibers of the infraspinatus becoming tendinous, and finally here are the fibers of the teres minor. So these three muscles, they are coming from the dorsal aspect of the scapula, whereas from the ventral aspect you can see this is the subscapularis muscle, again becoming tendinous and blending with the fibrous capsule of the shoulder joint, forming the rotator cuff. So it is a very important question for the first year MBA exams, the rotator cuff. Kindly remember the mnemonic for it, that is SITS, or the sits muscle. The supraspinatus, infraspinatus, teres minor and the subscapularis. In today's dissection video, the most important thing that we need to see is how the different structures, they pass from the dorsal to ventral and ventral to dorsal aspect. So there are certain spaces, potential spaces in between the different muscles. These spaces give the pathways for these neurovascular structures to pass around. So what are the different intermuscular spaces? Let us see. So students, here is the dorsal aspect of the shoulder joint. You can see here is the dorsal aspect of the scapula showing the spine. Here is the shoulder joint, the head of the humerus. Alright. Students, you can see these infraspinatus muscle has been cut and removed, but you can see its insertion as the musculotendinous rotator cuff. So kindly focus your attention on these few muscles. The teres minor, which arises from the middle one-third of the lateral border of the dorsal aspect of the scapula. So here you have the teres minor muscle. Then you have the long head of the triceps, which arises from the infraglenoid tubercle, and you can see it is moving down. So this is the long head of the triceps muscle. Then here you can see this is the shaft of the humerus. Alright students, so the teres minor, the triceps long head, this shaft. Finally, I want all of you to look at this structure. This is the muscle passing below the long head of the triceps. This is the teres major muscle. The inferior border of the between the inferior border of the teres minor, the lateral border of the triceps, the superior border of the teres major, and the shaft of the humerus. This place is known as the quadrangular space. Now, students, what is the importance of quadrangular space? So, as you can see, two important structures, that is the axillary nerve and the posterior circumflex humeral artery. So, the axillary nerve, the yellow colored one, and the posterior circumflex humeral artery, they are passing through this quadrangular space. Now, coming to this space, which is enclosed by the lower border of the teres minor, upper border of the teres major, and the medial border of the triceps. So in this space, we have an important structure, that is the circumflex scapular artery. This is the posterior circumflex scapular artery which arises or which passes through the upper triangular region. Then coming to the lower triangular space. So this space is the lower triangular space. So what are the structures which are bounding this lower triangular space? So on the lateral aspect, you have the shaft of the humerus. Here you have the shaft of the humerus. On the medial aspect, you have the lateral border of the triceps. And superiorly, there is the presence of the inferior border of the teres major. So students, in this lower triangular space, two important structures pass, that is this nerve, which is the radial nerve, and the artery, which is the profunda brachii artery. The profunda brachii artery. This profunda brachii artery, students, it is nothing but the deep branch of the axillary artery. It passes to the posterior compartment of the arm through this lower triangular space, and it gives blood supply to the posterior compartment. Similarly, this radial nerve, as you can see, it is coming and giving branches to this muscle of the posterior compartment of the arm, that is the triceps. The radial nerve further it will move down along the posterior compartment of the forearm as well as our hand and give innervation. So students, these three spaces are very important from the point of view of your exam. So the structures passing through them, knowledge of it is very important. So these things now we will see in the dissection video.
Here you can see one half of the trapezius muscle. We have already discussed about it. And if I reflect this muscle, you can clearly see a large nerve coming and innervating this muscle. So what is this nerve? This is the spinal accessory nerve, which provides the motor supply to the trapezius. Now, as you can see, here you have the supraspinatus muscle. Here you have the infraspinatus muscle. Now, coming to the shoulder joint. Here you can see this is the deltoid muscle, the posterior fibers of deltoid and the middle fibers of deltoid. Now an incision has been given along the origin of this muscle and now it has been reflected. Now as we reflect the deltoid, we can see large number of nerves innervating this muscle. So these nerve fibers innervating this muscle belong to the axillary nerve. So if we trace, we can find the axillary nerve is present here. So this structure is the axillary nerve. Along with it, we can see some blood vessels. These blood vessels are the posterior circumflex humeral blood vessels. Now students, as you know, the axillary nerve and the circumflex humeral blood vessels, they wind around the surgical neck of the humerus. Hence this site is the surgical neck of humerus. Now students, I also want to show you one thing. This muscle, the infraspinatus. You can see as it approaches the shoulder joint, it has become membranous. Similarly, as you see, this muscle, the supraspinatus, it is also becoming membranous as it approaches the shoulder joint. As well as here, you can see this muscle, this is the teres minor. The teres minor also becoming membranous. So these muscle, the supraspinatus, infraspinatus, teres minor, and another muscle which is present on the ventral aspect of the scapula, that is the subscapularis. Together, they form this sheet-like structure which blends with the fibrous capsule of the shoulder joint. So this structure is known as the rotator cuff of the shoulder joint, which helps in stabilization of the shoulder joint. Now, students, let's move on to the different spaces in the scapular region. Now, first you have to identify this is the scapula. This is the medial border. This is the lateral border. So along the lateral border, inferiorly, we have this large muscle known as the teres major. Above it, we have the muscle which is known as the teres minor. So this is the teres minor. Here you have the teres major. Now this muscle is the long head of the triceps, and here we have the shaft of the humerus. So these muscles, they cross each other to form the quadrangular space, the triangular spaces. So here we can see from the quadrangular space, these structures are moving from the anterior to posterior region. We have the axillary nerve and the circumflex humeral vessels. Now coming to this lower triangular region, we have two important structures, the radial nerve and the profunda brachii artery. This profunda brachii artery is the deep branch of the axillary artery, and it comes behind and provides the blood supply to the posterior compartment of the arm. And as you can see, the radial nerve is piercing through the triceps muscle. It supplies the muscles of the posterior compartment of the arm, the forearm, as well as the palm or hand. Now students, this is the upper triangular region. So in this we have a single structure which is the circumflex humeral artery, which needs some further dissection. So here we can see this circumflex. So students, as I reflect the latissimus dorsi, we can see the deep muscles of the back, the erector spiny group of muscles. They consist of the iliocostalis, the semispinalis, and other muscles. What I want to show you is the origin of the muscles of the abdomen. So anterior abdominal wall, as we know, it has the muscles, the external oblique, internal oblique, and the transversus abdominis. Out of these, the two muscles, external and internal oblique, are taking origin from this iliac crest. So this layer with the fibers running down, vertically down, this is the external oblique layer. As this muscle moves forward, the fibers will be running in a direction inferior and medial, that is hands in the pocket direction. Below this you can see this layer which is the internal oblique muscle. Here you can see these muscle fibers are running upwards and laterally, and as they move forwards they will move upwards and medially, that is in the